Yeah.
Hi, my name is Carol Hill. I'm a registered nurse in the emergency department at Vidant Medical Center. I've been there for about the past 10 years. Today, I would like to take a few moments of your time and explain to you about a patient situation in which a medication error occurred and things that we could do to possibly prevent that from happening again. This topic is taught in your Nursing 330 course titled Law and Ethics for Healthcare Professionals in your RN to BSN program at the University of Mount Olive. This video is an assignment for my Master of Science in Nursing degree program at the University of Mount Olive. This short 5-minute or so lecture will be using Principles of Adult Learning by theorist Malcolm Knowles. I have 3 goals and objectives for the brief lecture, and they are as follows. Number 1, understand adult learners and how they learn from life experiences. Number 2, understand what motivates adult learners. And number 3, understand that there are 3 stages of adult learners. Let me give you a brief overview of what happened to a patient. A new graduate nurse, recently off orientation, was assigned a post-op patient with an epidural line in place. This nurse had never cared for an epidural line, and it was obvious that she was scared. The new graduate nurse gave the patient the best care she possibly could. However, she inadvertently connected the insulin drip to the epidural line. The patient's condition deteriorated rapidly and resulted in the patient being transferred to a higher level of care. How can we apply this experience with our everyday practice? Well, first off, this is a life lesson. And as adult learners, we learn from the life lessons. We tend to grow from our mistakes and share them with others so that they do not make the same mistakes that we have. This experience motivates us as adult learners. We want to do what is best for our patients. We could always incorporate asking questions, using our resources, and utilizing the 6 rights of medication administration, which are the right patient, right medication, right dose, right time, right route, and right documentation. Adult learners are broken down into 3 different groups: young adulthood, middle-aged adulthood, and older adulthood. And we must remember that we all learn differently, but all stages want to do what is best for the patient. A great example would always be to ask questions if you're unsure. You wouldn't go skydiving and jump out of a plane for the first time without an instructor, would you? Of course not. Same basis. If we're unsure of a patient's condition, treatment, medication, anything that's going on with the patient, we should always ask questions, utilize our resources. This brief lecture discussed the adult learner and learning from life experiences, the motivation of an adult learner, and the different stages of the adult learner. The information provided to you was supported by the current evidence found in the text of Nurse as Educator, Principles of Teaching and Learning for Nursing Practice. Thank you all for your time and attention today. Please complete the survey provided through the Nursing Center and email it to my professor, Dr. Jennifer Sugg, at jennifer.sugg@umo.edu. Thanks again and have a wonderful night.